Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. One of the things that patients are probably not ready for is this relationship you're about to have with your doctor, because when it comes to a cancer diagnosis, this becomes a pretty long-term relationship. Also, this is a really important diagnosis. You're not being diagnosed with something that you're just going to be handed medication and go home. There are a lot of decisions to be made. There's a lot of relationship between you and your doctor that's very important. So what I mean by that is I think you should expect from your doctor, first of all, to be informative. I mean, your doctor knows that you're not in the field of medicine, you're not in the field of science necessarily, and so you might need some extra explanations about what the diagnosis is, what it biologically is, what it means for you, and you might even need your different options laid out more than once. So a doctor who's informative is very important. And then expect your doctor to be willing to answer questions. And in my experience in the field of oncology, doctors are very willing and very ready to answer your questions, maybe direct you to somebody for certain types of questions, but they really want you to understand your cancer. And I think that's because in this field, doctors are really trying to partner with you. They want the decision making to be a partnership between you and the doctor. They want you to be fully informed. They want you to understand the decisions that you're making. They want you to be comfortable. And I'm here to tell you that your comfort with the doctor actually can play into how well you do as well. If there's resistance to your doctor, or you don't fully trust your doctor, it's not going to go well for you, and you're going to be very uncomfortable. It could even affect your quality of life and even your outcome. So it's very important that your doctor's informative and that your doctor answers questions, has patience with you, and has time for you, and also is up on the cutting edge of all the information for your type of cancer. When you receive a cancer diagnosis and you know what you're expecting from the doctor, you know what you're expecting from your friends and your family, sometimes we forget to stop and think, well, what is my role? So as a cancer patient, you have a role in this. This is not you going in for a minor surgery and recuperating for a week. This is you getting actively engaged. And I can't stress that phrase more. You need to become engaged in your diagnosis, understanding it, engaged in knowing about it. But when I use the word actively engaged, I mean there's things for you to do. You actually need to be very careful about keeping your appointments, having scans, having lab tests, know what those are. It's not a bad idea to even keep a notebook of all of your records so that when you go from one doctor to the other, you have taken on the responsibility as well of having your records with you. It's really helpful for everybody, and it makes you feel more confident and more secure in what you're doing. When you feel more actively engaged in your treatment, you actually get a little more control. So that brings us to the fact that that's one of the hardest things about a cancer diagnosis, is that people feel very out of control. At some level, they feel that they didn't control getting to this diagnosis, and now people are starting to make decisions for them, and people are starting to tell them what they need to do, and their life is turning upside down. So to gain back some control, it's really important to get actively engaged. Go to your appointments, do the things your doctor asks for you. Become interested in your overall health. Is your nutrition good? Are you exercising well? How are you dealing with your stress? Your active engagement in your diagnosis will actually increase your quality of life. You'll feel better. You'll do better through treatment. Day by day, you might look for other people who can engage with you, and maybe they exercise with you, or maybe you go to a group where you get more information, and now you feel like you have a group of people who've gone through what you're going through, and so they understand it together. That's an active engagement. This isn't the kind of condition where you just let someone else do what they need to for your body and do what they say and everything just comes out okay. Your role, your engagement, You're letting the doctor know how you feel, how your symptoms are, what has changed, what hasn't. Everything you can do for yourself will give you control, security, and also very likely make your outcome better. So becoming actively engaged and coupling that with patience. So the other side to that is your expectations might be very high for yourself. What you need to do is calm down, relax, know that this is a day by day type of coping, that you yourself are getting adjusted to the very idea that you even have cancer. And as that happens, you have to be patient with yourself so that you can be to step with what's going on with the treatment and that you feel like you're engaged and you're part of the treatment as well.